Pharmacokinetics. The topics to be covered today are Introduction to Basic Concepts of Pharmacotherapy, Introduction to Clinical Pharmacokinetics, and Important Pharmacokinetic Parameters. First of all, what is pharmacotherapy? Pharmacotherapy is the treatment of diseases through the administration of drugs. And the important parameters in pharmacotherapy are the drug that is to be used or the drug combination that are to be used for the indication, the dose of the drug, the dosing frequency of the drug, and the route of administration. Other factors that can impact pharmacotherapy are the dosage form. For example, the tablets versus the IV injections versus IM depots. The patient factors that can affect pharmacotherapy are the age, gender, disease conditions, for example, liver and kidney disorders, allergy to the drug, pharmacogenetics, pregnancy, lactation, and other special physiological conditions. Then drug-drug interactions and ADRs can also impact pharmacotherapy. Clinical pharmacokinetics, the application of kinetic principles to the safe and effective therapeutic management of drugs in an individual. The aim is to enhance efficacy and decrease toxicity of a patient's drug therapy, and plasma drug concentrations are affected by the rate at which a drug is administered, the volume in which it is distributed, that is we call as volume of distribution or VD, and its clearance. If you look at the profile of multi-drug administration, the plasma profile fluctuates between the low and the high, that is a crest and the trough levels, or the peak and the trough levels. And when medications are given on a continuous basis, serum concentrations increase until a rate of drug administration equals the elimination rate. And steady state serum or plasma drug concentrations are used to assess patients' response and compute new dosage regimens. The important parameters from clinical pharmacokinetics viewpoint are the bioavailability of the drug, that is how much of the drug is absorbed through different routes of administration, the apparent volume of distribution, how distributed the drug is in the body. For example, those drugs which are highly plasma protein bound exhibit a low volume of distribution, half-life of the drug, or the elimination half-life of the drug. This is important to determine the time which will be required to obtain steady state plasma concentration. The clearance of the drug, this can be broadly classified into two categories, the creatinine clearance or the renal clearance, and the hepatic clearance of the drug. So depending on the changes in physiology of the patient due to disease conditions or aging, the creatinine clearance or the hepatic clearance of the drugs could change and may need to and may require dose adjustment. The area under the curve is the area under the time versus plasma drug concentration curve, and is an important factor to determine the bioavailability of the formulation and bioequivalence. Then steady state plasma concentrations, these are the steady state concentrations which are generally achieved after 5 half-lives of the drug, and is important factor when we are considering for therapeutic drug monitoring. Plasma protein binding is another clinically important parameter and plays an important role when deciding dosage regimens. Since free drugs are the drugs which are metabolized and are the one, and free fraction is the one which is involved in a therapeutic effect, the changes in plasma protein binding can significantly alter the therapeutic as well as the toxical profile of the drug, and may require dose adjustments.